So I guess we'll get started. Welcome to the panel on Changing Landscape of Philanthropy, Implications for the Development Community. This panel is hosted by the Challenge Initiative, and the Challenge Initiative uses a business unusual approach to scaling up and sustaining proven urban reproductive health solutions. Part of the model, we leverage resources from local governments and donors like you'll be hearing from today. The Challenge Initiative focuses mainly in urban locations in Africa and then in India. So welcome to this exciting panel. I'm sure you have read the abstract on it, and so I'll cut short the introduction to it. But in the next 80 minutes, we will host a candid conversation about the donor landscape for global health and family planning, meet some dynamic philanthropists and family foundation leaders who are changing this landscape through their leadership, resources, and novel approaches, to hear about what this means for their work and what we, as a family planning community, need to learn about working with these innovators. If I think about the changes we are witnessing in global health in relation to donors and money, I'm wondering if the landscape is in fact changing. We have an amazing set of leaders in philanthropy working in global health and family planning from the US and Asia that will help us answer this central question today. What do these shifts in direction mean for family planning? How can family planning implementers align with philanthropic needs to examine new partnership and means of mobilizing funds for family planning? Our discussion today will center around emerging trends and strategic investments with private funding sources that will include high net worth individuals, family foundations, and philanthropic networks. The objectives are stated in your books, and so I wouldn't go into it. I'd like to introduce myself. I am Kojo Loko. I'm the Deputy Director of the Challenge Initiative, and once again, welcome to you. So I am thrilled to introduce our panelists for this afternoon session, and there are 5 of them, very distinguished panelists here. We are fortunate to have philanthropists, leaders, and senior staff from several family foundations, some of which are business and philanthropy board members, and we also have a health development financing expert. So thank you, panelists, for joining me up here on stage and for this TCI's first donor panel. First of all, I'd like to introduce them by welcoming Carol Lassen. Carol, the Chief Executive Officer at the Packard Foundation. Carol has held the Chief Executive Officer position at Packard since 2002, and previously served as the Director of Programs. Earlier, Carol was a lawyer specializing in civil litigation. She serves on the boards of Climate Works Foundation and Sobrato Family Foundation, and earlier a board member of the Council and Foundations, and serving as chair from 2010 to 2012. Welcome, Carol. The next sitting to Carol is David Zuelik. David began his career in the Zuelik Group in 1989. The Zuelik Group owns and manages a large, diversified portfolio of leading businesses in Asia. Currently, Mr. Zuelik is the trustee of the Zuelik Family Foundation, which focuses on improving health outcomes through sustainable healthcare solutions, examining inequities in healthcare access. Additionally, Mr. Zuelik is a member of the board of the New Asia Philanthropy Circle, which is registered in Singapore and works to share learnings and insights into philanthropy to catalyze Asian philanthropy. Again, welcome, David. Next to David is Natalie Revelle. Natalie is from the Bill and Melinda Gates Foundation and is currently the Deputy Director for the Strategic Investment Fund. Natalie leads the Volume Guarantee Initiative, structuring a portfolio of investments across vaccines, family planning, and HIV products that are expected to generate over $1 billion worth of procurement savings to the global health industry. Before this, Natalie held a number of strategy and financial advisory roles, most recently at the McKinsey and Company. Most recently, she was at the McKinsey and Company. So welcome, Natalie. Sitting next to Natalie is Anne Morris. Anne is a veteran award-winning journalist who now works as an advocate, volunteer, and philanthropist. With over 3 decades in daily newspapers, she comes from a newspaper family and is a true believer in the power of storytelling and speaking truth for change. She has worked as a church outreach director in Kenya and Latin America and serves on the board of Planned Parenthood of the South Atlantic, among other volunteer assignments. Anne is a Maverick Collector member, a strategic philanthropic initiative of PSI, where Anne supports a pilot-based family planning program in Kilifi County in Kenya. Welcome, Anne. And the last, but certainly not the least, we have Amanda Glassman. Amanda, generally, if you have read any strategic analysis about health development and financing, it is likely that it was written by Amanda or her colleagues at the Washington-based Center for Global Development, where Amanda serves as the Chief Operating Officer and Senior Fellow, as well as the Secretary of the Board. Amanda's research focuses on priority setting, resource allocation, and value for money in global health, as well as data for decision making. Before this, she served as Director for Global Health Policy at the Center from 2010 to 2016, and was Principal Technical Lead for Health at the Inter-American Development Bank. And there she served as Deputy Director for the Global Health Financing Initiative at Brookings and was a Fellow at USAID. So, distinguished audiences, this is your panel for this afternoon's session, and can you please give them a round of applause? So this is what the format will be. I'll be joining the panelists, and we'll be asking them a couple of questions, and they will also have some conversations amongst themselves, following up with some of the answers that they provide. And then at the end of it, we will provide about 15 to 20 minutes for you, the audience, also to ask them questions. And so, without much ado, allow me to join the panelists to set it rolling. So welcome again. And so my first question basically is to all of you, and you probably will take them one after the other. And so I'll set out the question, but then we'll provide some specificity to each one of you as you get ready to answer the question. So what would you say are important changes and trends in the donor landscape? And that is regarding philanthropy. And what important changes are you seeing in the global health space and in family planning for that matter? And what are the implications? And so I'd like to go to you first, Amanda. So being at the Center for Global Development, you've been tracking changes in the funding landscape and policy implications globally for FP. What are the major donor trends that you're seeing from your perspective in the global health and family planning arena? And I recognize that CGD and the Kaiser Foundation recently published a report to examine these shifts from family planning and prepared a number of key recommendations for the FP donor community. I'd like to hear from you, Amanda.
Yes, thanks a lot. So overall, we've been very fortunate that global health funding, the external funding for global health has been growing, and likewise domestic funding has been growing, not by much, but it's still on an upward trajectory. But before we think about family planning financing in that context, I think the question is, what does good family planning financing look like if we'd like to meet the FP 2020 goal of serving those 120 million women and their families that have unmet need? So I'd say there are 3 S's. First, it should be sufficient to serve those that want to use today and tomorrow. In 2016, there's the new FP 2020 report, plug. They're estimating now that we are collectively spending about $3.5 billion a year. Some back of the envelope math would tell us that we need about $4.5 billion per year to serve the entire 120 million. So we're not yet sufficient. I think the second attribute would be that the funding is stable. This is important because we know that family planning is an essential commodity. We want to be able to use it regularly. We don't want sudden stops and starts to money. And I'd say from an external funding point of view, we've done okay, with the exception of the past 2 years in the United States, where we've seen some unpredictability, let's say, in the amount of budget that is being allocated to family planning. For the past 2 years, 2 years ago, the administration proposed a 0 budget for family planning. Last year, it was a 50% budget for family planning with respect to previous years. Now, Congress sort of balanced the scales, and USAID itself has been programming to avoid any kind of disruption, but I think if you're a major recipient country of US government assistance, and it's likely that you are because the US is the biggest funder, 80% of donor money is coming from the US government. And in some countries, external funding represents a huge share of their program, right? So about 50% in 9 or 10 countries, about half the program is externally financed. So that represents a huge source of uncertainty and instability. The third is sustainability, everybody's favorite buzzword. But what does that really mean? It means that it's affordable to the public purse to serve those that can't pay, and it's affordable if I'm a household or a person that needs to pay out of pocket. And I guess my question for us as we talk about the role of philanthropy and external funding with respect to domestic funding is, are we creating incentives with our external funding that is motivating more domestic funding? I'll cede my turn because I'm talking too much, but I have just a final point, which is about results. I think the money needs to work better for results. If we're not maybe going to get $4.5 billion each year for family planning, so how much more can we do with the $3.5 billion we have today every year? Thanks.
Thank you, Amanda. And so not only is it changing, but then there is a gap. And I think that is what even makes it interesting that, the space is more or less reinventing itself in certain ways, and we need to be aware of what is going on in there. Allow me, Carol, to ask you, you've been president of Packard Foundation for 15 years. What changes have you seen in the donor landscape? And as a strategic donor, can you help us understand your foundation's approach to family planning? Has anything changed over time?
Great. Thank you. Am I on? Hello? Okay, good. Thank you, Kojo, and great to be on this panel with everyone. We're going to try to keep our answers crisp. So, yes, over the 15 years, there are some things that have stayed the same. I think we have always had insufficient funding, unstable funding, and a question about sustainability. So some things are the same. But I also think that many things have improved, at least from my vantage point in private philanthropy. And my other 3 panelists besides Amanda are all representing different forms of private philanthropy. So I'll just mention 3 trends that I think are very positive. One is the famous C word of collaboration. Everyone uses it. But for the last 5 to 6 years, I think from my vantage point, the way that private donors are collaborating has really improved with new vehicles and new platforms that bring us together in a much more powerful and effective way. So I'll just mention 3 that we're a part of in this space. One is the Girls First Collaborative, which was focused on ending child marriage. And it isn't until a bunch of funders come together, whether they're individuals or private foundations, to pool their money and to actually share strategies that we can use those limited dollars that Amanda was talking about in a more effective way. Another one was Amplify Change, which we also are a part of, but there it was the question about the big bilaterals wanting to get the money to the communities, to community-based organizations, but needing a vehicle to do that. And private philanthropy came in and set up a special fund. I think it was Sarah Symes at Hewlett at that time, who had the initial idea for it. But really, I think it's functioning pretty well as a way for bilaterals to give significant amounts of money to this new platform and then have that money flow much more efficiently into communities globally and community-based organizations. And then, of course, in part of the instability that Amanda was talking about is we had a new president and the gag rules put in place and funding dropped. And so there the she decides collaboration, where some individual donors really stepped up, got a bunch of us to make new commitments to not remove the gap, but to help ameliorate it. So collaboration, but really through some new platforms. The second is, and I think my colleague from Gates Foundation will talk a lot more about this, is we're realizing at Packard we make hundreds of millions of dollars in grants each year, but we also really see the power of impact investing, of using, in our case, it's a carve out of our endowment, to make low interest loans or equity investments where we're really seeking programmatic impact. And you'll see many more foundations doing this, and it can really have a big, big effect. I think, and I think my colleague will agree with me, there's a little bit of hype out there about impact investing, but there really is a role for philanthropy to be seeking impact first and to making catalytic loans or equity investments. The third thing that I'll just mention as a trend, as something particularly for this moment in time, I went to a great little discussion this morning around the role of advocacy organizations and whether these were big organizations, international NGOs, but about on-the-ground advocacy. So as you have these drops in funding, or you also have instances where they're in transition countries where USAID support or others are diminishing, that focus to on-the-ground advocacy and coordination among funders is really important. And I don't think we always do a good job of that, but one of the things about philanthropy, I was saying to my colleagues this morning, one of the quotes I've always loved about philanthropy is that it can be a passing gear. In other words, there's no way are we going to fill the government funding, but can we actually spur bigger leverage because we have more freedom in how the dollars are deployed. So I like to see increasing amounts of that used for more risk-taking and advocacy. So those are my three trends: greater collaboration and with new platforms, an increase of impact investing, and third, this heightened attention to the importance of on-the-ground advocacy support. Thanks.
Thank you, Carol. So we will be hearing, you did mention on your first point about collaboration, and we'll be hearing a lot more about the importance of collaboration in this space. I mean, to be able to go far and in a sustainable way, there need to be more partnerships in that space as well. And I'm sure that the panelists will throw some more light on some of those. David, to you. We're excited that you've joined us as a major health donor in the developing world, and where private philanthropy is now beginning to shape up. You have been at the helm of affairs at the Zuelik Family Foundation since its inception, working with local governments, international donors, and several sectors to expand your foundation's work in maternal and neonatal health, including family planning. You were also named, and I'd just like to underscore that, as a top philanthropist in the Philippines in the Forbes magazine recently. And you're part of the Asia Philanthropy Circle. And I'd like to hear a little bit more about that aggregation of foundations. Can you please share with us what changes you are seeing with regard to private philanthropy and what this means for the improvement of reproductive health in the Philippines, as an example?
Thank you. Does this? Can you?
You don't have
Does it?
There's a green light on.
Yes, it is on.
Okay, then it
Okay,
should be
it works. All right. Thank you for the question. What we see in Asia is that there is a lot of what I would call targeted philanthropy, which means that there is a lot of activity. We have in Southeast Asia, we have philanthropists. You will find that these philanthropists are usually they're from family businesses. It's very often their activities are more CSR related, and what I find quite interesting in a way is that where additional capacity comes in is actually from the banks. So if you ask a banker where they see their competitors, it's really with these family philanthropy organizations. So there is fragmentation. There is not a lot of cross-border activity. And it is perhaps for that very reason why in Singapore we created this entity in Singapore that really in essence is an aggregator of philanthropists. We're around 30 members. We plan to increase that to about 100 to make it more meaningful. We cover pretty much all of Asia currently, with the exception of India, but that includes China, etc., and a number of countries in Southeast Asia. And the idea really is to foster collaboration. That is probably the best way to address these issues because, as I said earlier, we have these targeted approaches, and you have to incentivize people to communicate. And given that we have philanthropists who cover a range of areas that do not necessarily just focus on health, we have also decided to create funds for individual activities. Now, health for the time being we're in a bit of a minority. I hope that will change at some point. And I guess to some degree that will also be my job to see to that. But and really, as far as fund for us, our experience is that we collaborate with UNFPA, we collaborate with USAID. We have also a program with MSD, and for us it is absolutely imperative that we have these associations. We have a model that will require us to continue what we're doing for a fairly long time to come. Actually, we have met a few months ago to discuss our next 10-year plan.
That's good. That's good to hear. Sorry, that's definitely good to hear. And in my conversation with you this morning, you talked about the fact that other development areas seem to get the lion's share of the private foundation or private philanthropy money. It's good to hear that we have an advocate in you, that we can begin to shift some of the resources, the direction of family planning and reproductive health.
Yes, and I think there, what perhaps I should say here is that what I've noticed is that when you talk to philanthropists, there is a tendency to prioritize. So a philanthropist who is in health will prioritize health. A philanthropist who is in education will prioritize education. And I'm at some pains to convince people that really, we're all in the same game, and we have to collaborate. If you have healthy people without education, there's possibly not much of an incentive to remain healthy or to spend money on health. Conversely, if you have a good education system and people are not healthy, then you're going to have an impact there as well. So for us, too, we do collaborate with institutions that are in education. We cannot claim to be good at everything, obviously. And as you pointed out earlier, we initially focused on MMRs, IMRs, because for us these were easy indicators, sentinels in a way, to see what the health status was in a community. And we also felt that the message going back to the constituents had to be an easy message, easy to understand. So from there, and with the trust that we have developed over the period of 10 years, we have actually managed to expand our service offering.
Great. Thanks, David. And we'll be hearing a lot more about it from your private foundation's perspective. Natalie, to you. So I would venture to say that most of us here at ICFP have a good understanding of the Bill and Melinda Gates Foundation and its grants. I would get so. But there's one side of the BMGF folks that many of us may not be aware of, namely your work in strategic investments. So Natalie, you're the Deputy Director of the Strategic Investment Fund at the Bill and Melinda Gates Foundation. Can you please explain what the Strategic Investment Fund does and how it functions within the foundation? And also, how does your work change the way family planning business is done in our community? Basically, probably veering a bit away from the traditional way of grant making. Please throw some light on that for us. And please educate us a bit about the Strategic Investment Fund.
Great, thank you. So maybe I will start with what the Strategic Investment Fund is at the foundation. It was set up about 10 years ago, really as a pilot initiative to allow the Gates Foundation to use private sector tools, investment tools, equity loan guarantees, to engage primarily with private sector better. And so we work across the foundation, so within global health, but also in global development and our U.S. education program. And what we try to do within the foundation is mirror the partnerships that we're trying to set up externally. So within every deal team, as we call it, we have someone from the Strategic Investment Fund that's bringing private sector deal structuring expertise and partnering that with the technical expertise of our program teams. And in this case, it's the family planning team. When we first started working with the family planning team, we do what we do with all of our teams, is understand what the team is trying to accomplish. In this case, the family planning team's goals are really to expand the contraceptive options for women and improve the service delivery and the quality of the services they're receiving. So I actually started working with the family planning team in 2012, right, with the London Summit. And we were trying to figure out ways to engage private sector in the start of that movement. And so we did focus on commodity markets with the same three goals, actually, that Amanda talked about for funding. Commodities that would be sufficient, stable, and sustainably provided. And so the family planning sector is really one where we had to be incredibly flexible and very innovative to make it work better. I don't want to say it's broken, but it hasn't worked super well in the past. And so what we've done is actually created a range of investment tools to work across the entire product development space. We can make equity investments in early stage companies that have platform technologies, let's say to deliver drugs on an extended basis, and we'll use our equity tools to do that. in the later stages of development, we've been increasingly using one of our most impactful tools, frankly, for increasing access, which is the Volume Guarantee Initiative. And all that does is provide suppliers with a fixed volume commitment in exchange for a capped price and access to supply. And we can talk more about the mechanics and the impacts of that in a little bit when we talk through the Implant Access Program. But that has been an incredible tool for public-private partnership, for collaboration between donors and suppliers. And in shaping that tool, we actually had to ask all of our partners to be more flexible with how they think about the business that they normally do. And then finally, we've started actually also experimenting in the service delivery space and how do we get it to work better and provide better services. So our loan program with DKT in particular is basically trying to take the same principles from our volume guarantee work, reduce costs by providing larger scale, and trying to apply that to service delivery to see if we can get the same sustainable low costs that allow for lower pricing and improved quality. So I think in what we're trying to do is we're trying to increase the number of tools we have to go tackle the really hard problems that family planning is facing. And that's what the Strategic Investment Fund is trying to do at the foundation.
Great. Well, thanks, Natalie. And we'll come back to hear a little bit more about some of the mechanisms and maybe a little bit more about the tools. And so generally, philanthropy has been working to reduce barriers to entry so that many more can join in or can join. As an active philanthropist yourself and with the Maverick Collection, can you please tell us about the collective and your role? We're also eager to understand how you have come to support family planning, because as I understand, you have a strong faith background, and which is very important to you, and you have been in development for quite some time. So we'd like to hear from you your personal motivation for being in private philanthropy, and tell us a bit more about the Maverick Collection.
Okay. All right, thank you. And thanks for having me on this panel. I'm very honored to be here. So I just wanted to share 3 observations from my perspective that may be of some help today. First is the panel, as we've all said, the traditional donor landscape is really changing. And it seems that there is a particular need now for new donors, for folks who are willing to come in and provide sort of seed money, catalytic money that can really leapfrog us ahead with some of these difficult challenges. That's what Maverick is, actually. Maverick was founded about 5 years ago by PSI, along with the Gates Foundation support, and there are 25 Maverick members, such as myself, and each one of us are sort of helping to fund and to also drive projects around the globe that we really hope will be catalytic. They're sort of high-risk projects. They might fail, which is okay. We sort of have gone into it knowing that that's a possibility, but that the learning that comes from the failure is really, really vital and also serves a purpose in trying to help us move forward. So I think the first thing to think about is what is the opportunity around new philanthropists such as myself to engage in a catalytic way. The second observation is just the way that the healthcare landscape is changing, and for me it's personally exciting to be part of a time when we're able to bring care so much closer to women who need it in very remote areas of the world, such as my project, which is focused in Kenya, Kilifi County, Kenya. The idea that we can actually bring a contraceptive implant to her front door is just hugely exciting to me, and I think is very powerful in terms of the revolutionary potential. But to achieve that revolution, we have to have policy changes at a national government level. So I think the advocacy piece that Carol mentioned is really important. It's personally to me, being an advocate is just as important as being a funder be able to have a voice and speak to those kinds of changes. And then finally, the third point is just my own background is, I have a faith background, and so I think sometimes we forget that family planning and faith actually can go hand in hand. That those two, to me, personally, if we really want to honor the divine spark and the dignity of all people, whatever faith you come from, or without a faith background, but if that is our goal, which I believe it is, then we need to be sure that we're including people from a faith perspective, and that we're working upstream, not just sort of at the end of the line sometimes with charity. We need to work upstream to empower women to make choices in terms of their having children and their families. So, thank you.
Thanks, Anne. And allow me to just drill down a little bit on that. I mean, it's impressive to see you as a philanthropist in yourself, and being still at the forefront of actually doing work on the ground in like Kenya. Can you give us some of your personal experiences about your work in Kenya, and what have been the learnings working in this space? And we probably say it because there might be others like you who probably will find it exciting to be at the forefront of the actual work in the developing world. So throw some more light on it and tell us about some of your experiences and generally the innovations that you have applied there and the challenges as well.
Okay, I'd be glad to. I was in Kenya last year, and we had the opportunity to visit in Kilifi County and go to a very remote rural village and meet with several women. And one woman whose story has just really stayed with me and touched me and informs our work is a woman named Riziki. And she was at 30 years old. She had already had 9 children and was expecting her 10th. And was living in a very, very extremely high poverty kind of situation. The children were hungry and not in good health. And she knew about family planning, and she knew enough to want it, and had asked her husband, but he had turned her down several times, and didn't have the sort of the cultural appreciation that this was a good thing for her to do. So we were able, after we met with her, we were able to arrange for some counseling for the couple. And I think he came to see the light that this was in the family's best interest for her health, to space out children, and also for the family's economic health, to keep her as a provider for those children. So she was able to get an IUD, and 10 children is a lot, okay. But at least at this point she has a chance. So the stories like that, to be able to bring family planning methods, the full mix of methods, but we're focused on implants, to women like Riziki is really what motivates me.
Great, thanks. Carol, with our audience here and being head of one of the leading family philanthropists or private foundation working in the area of family planning, I'm sure the audience would like to hear some of the priorities and the direction for the Packard Foundation in the space of family planning. What kind of nuggets can you throw out here in terms of what you are thinking about long term in the space of family planning?
Good, and I'll do that also referring to some comments of my fellow panelists. So, one is hearing both from David and Anne, and both from their personal examples, is private philanthropy needs to keep growing. And for those, our foundation's been around for 54 years, but there are just so many families in the world who have accumulated some wealth, who want to be involved and be engaged. And I think it's all of our work together to help create vehicles and platforms for that to happen. And David, as I understood what you were saying is, and we're finding this in our experience in Silicon Valley, is there's such a big focus on scale and kind of scaling a single solution. And I love what Anne's saying, and I think, David, you said this too, is that over time you realize that that isn't the only way to have impact, that there has to be some messy risk-taking too, some messy advocacy, and not just finding a scalable silver bullet solution. A second thing related to, I think, all of our work to grow philanthropy is something you said, David, too, about finding the connections among your issues, and reaching out to new donors or even to other foundations. And you say, well, no, I only do K through 12 education, or I do the environment. I mean, we have a story to tell around family planning and reproductive health that relates to both of those things. And so how do we broaden that? So I would say one emphasis for us at Packard is how do we keep reaching out to the new philanthropy and try to work together to bring more money into the field. Second is I just came from the quality innovation lunch that Packard's hosted now at the last two, and now this is the third event. And I don't know, how many people did we have there? I see several members from our staff in this room, but there were hundreds of people there. And I think for Packard, trying to figure out ways to invite new voices and new ideas. I mean, yes, we have our strategic frameworks, we have our logic models, we keep focused, but I think all of us as philanthropists need to figure out a way to keep open to new ideas, invite new ideas, innovative, which means taking risk and seeing the value in some things are going to work and some of them aren't. The third and final thing is we are doubling down on youth, and I love what I've been reading from our own team, and I think it's shared by many people here, and that is to change that frame. It's not, I would always say children are our future, youth are our future, and we want to change that frame to no, youth are the leaders now, and it's not just something you grow into down the line. And so trying to figure out how we as philanthropies can really give true power and true voice to the youth of the world. We had some great examples at the opening plenary with the youth spokespeople, and it's just terrifically exciting. So those are three things, Koja, that we're giving special priority to.
Okay, great. And so for your audience, you realize that I'm actually seeking your interest. I knew that some of those questions were already going through your head. We'll offer you some time to ask questions in a couple of minutes, so please start formulating your questions. Can I get back to you, Natalie? Regarding, you did embark on a strategic effort at the foundation to challenge costs and procurement systems for FP products to increase access for millions for implants specifically. How has this, and you did talk about certain mechanisms, and so basically I'm requesting that if you could go throw some more light on this, but how has this investment impacted the way family planning products have been manufactured, distributed, and priced to date? Is your mic on?
Is it too far?
Okay,
it was touched too
too
far.
Okay, good.
When we first started this project, Monica Kerrigan, who was at the foundation at the time, at the family planning team with me, said, this is going to be our tracer pill, and we're going to go along the entire value chain and find out the specific things that are wrong and try to fix them using this project. So one of the first things we did was, for the Implants Access Program, was to really understand why implants were underutilized. And one of the first conclusions was obviously that the upfront price of an implant is actually quite high relative to other methods. And so we went and talked to suppliers about why that would be. And it turns out there are several reasons. One is obviously a very common problem in global health commodities across the board, which is this high price, low volume trap. So oftentimes prices are high because manufacturers aren't able to fully utilize their facilities, and so that makes for low volumes and high price. And so the one thing we could do was to break that trap and provide the suppliers with what we call the volume guarantee, that they would be able to be guaranteed a certain amount of volume every year in exchange for capping their price, and making sure that there was enough capacity to serve the market. And that's a direct contract between the Gates Foundation and the two suppliers, in this case, Bayer and Merck. This is where I want to go a little bit into how we asked other partners to work differently in this public-private partnership. Because to do this guarantee, we worked with other the largest procurement donors to the UK DFID and the USAID. And we worked with other donors who didn't fund family planning commodities quite to the extent that DFID and USAID do, but they have the ability to make long-term commitments, just like the Gates Foundation. And that was the Children's Investment Fund Foundation, SIDA, which is a Swedish aid agency, and Norway. And they all thought differently and had to actually enact parliamentary rules to make these long-term commitments because they saw the value of being able to make the long-term commitments in order to lower the price and increase capacity. We also worked with implementing partners, UNFPA and JPIGO for training. And as we went, so the first thing we did was to lower the price. That was only one piece of it, using the volume guarantee. Then we went all the way through and realized you need to train and provide better counseling if you really want the product to get out there. And you need to coordinate supply to make sure that the product is getting where where providers are trained to provide the services. And we needed to work better with the manufacturers to know, so that they have an orderly pattern so that they can minimize costs. And so all along the value chain, this was a truly public-private partnership, and asking everyone to work a little bit differently and think a little bit differently in order to actually, as we were just working on a volume guarantee, fixing what I call the enabling environment for family planning commodities. And you know, if I may, I'd just like to read a few statistics from as the program was going to end.
I was actually going to ask you, tell us a bit about the success rates or the results. So
sure. So we had some metrics, and I would have to say that the program has met all of them. In terms of access, so 53 million implants were delivered to women. That's 2 times the rate from annually from before the program started. Cost savings. We actually generated $500 million of procurement savings that were then funneled back into buying other commodities or more implants. We created a coordinated supply planning mechanism where the countries can now report in and are housing it in order to facilitate commodities going to where they are needed most. We've set up implants removals through their training and service delivery because there's a responsibility. Obviously, you're putting an implant into a woman, they will eventually need to get it taken out. And so we needed to start the training right away to make sure that providers could also remove the implants. And the last piece is the sustainability piece. And I would like to give a lot of credit actually to Bayer and Merck, because halfway through the initiative, they saw that the changes were happening, the volumes were there, and they knew that the key to that happening was predictability of the supply and the price. And so Bayer and Merck have both announced that they would extend their pricing commitments another 5 years beyond the period of the volume guarantee through 2023. So imagine having price stability on one of the most expensive commodities for 11 straight years, and that's what we have here. And then, sorry, one last point, I'll try to be crisp, but you know, in terms of using multiple tools together, the guarantees weren't replacing grant dollars. We were still making grants to improve service delivery and coordinated supply planning. We actually also continued to make grants to a third supplier of contraceptive implants to make sure that they could receive WHO pre-qualification to ensure that the sustainability of the supply and the security of supply would also be maintained going forward. And so that kind of commitment to take a holistic look at the entire value chain and to all work a little bit differently, a little bit more creatively, has created an incredibly impactful program.
Great. Well, thank you, Natalie. David, I'd like to take advantage of the fact that well, this panel is being recorded and probably might find its way to certain places. And there are people like you who may be thinking, maybe I'm not there yet. Or probably, what do I get from this? I'd like to hear about a particular experience in the Philippines where you recorded in several LGAs reduced maternal deaths, in fact, to 0, due to the investments that you put in there. Can you just give us, I mean, that's one example, and if there's another example that basically speaking to this audience and to others who may see, to motivate them that investments like that actually creates results.
All right, yes. Well, we have, 10 years ago, we decided really to focus on MMRs, IMRs, and what we did was we, instead of focusing on just on the community, we actually engaged the mayors, what we call the local chief executives. Mm-hmm. And I think one thing perhaps I should also mention here is that in the Philippines, same as in Indonesia, the healthcare system is decentralized. And this happened in around 1991, 91 or 92. The effect was negative because the law came, or the change came into force practically overnight. The mayors were not prepared, so there was, in essence, there was no budget allocation. There were no healthcare workers didn't know what to do. The DOH was certainly no longer as effective as they used to be, so there were a number of challenges. What we did was originally we picked initially 9 prototype communities, and we tested our what we call health. What is it? Health change. The health change model. Yes, and so that in essence what it means. We train the mayors. We emphasize that health is important. We train the mayors, so they apply a certain part of their budget allocation from the center to health. The first prototypes, needless to say, were actually very encouraging, the results, because we picked them in order to prove a concept rather than to make our own life more difficult. But then we found that we kept on expanding, and I remember we had a meeting and we were quite happy with 72 municipalities that we engaged with. And in 2013, the DOH, the government, the Department of Health, approached us and said that they would like us to roll out the program nationally. Mm. That was, to us, I mean, we obviously it was very pleasing to hear, but also a tremendous challenge ahead. The first decision we made was that the funding that would be made available by the government to do this was going to be separate, so it wouldn't be channeled through our foundation. Okay. We picked of the municipalities. There are around 1,400, between 14 and 1,500 municipalities. We picked those that we felt we would be able to communicate with. Today we cover around 40% of the country, and it's not that we focus on particular islands or areas. Mm-hmm. It's actually we are represented from all the way from the north to the south. That includes the Muslim areas. Yeah. You mentioned that you took an example where we have been particularly successful. What we find is that it's obviously that in the better organized communities, these ratios are easier to deal with. But we find, for instance, in the Muslim areas that there are some challenges, and it's really a question of patience, of working through issues with them. But the trend, actually, whilst it may not be as rapid, perhaps, it's encouraging nevertheless.
So obviously that there are disparities, but there has been some tremendous success for which your foundation deserves a lot of commendation. I'd like to move on to Amanda, and we might come back to you to hear another example of some of the successes on that front. Amanda, you've been quiet for quite some time. It's kind of a loaded question, but let's take it in your stride and let's see how we go. Are high net worth individuals and philanthropic foundations supporting FP programs in a different ways than traditional donors? And we'd like to hear your perspective. What should the FP implementers take away from that shift, if there is? And are there any lessons to be learned from the experiences of family planning implementers in high-income countries? And then, given your work on cost effectiveness and evidence-based programming, are there any new FP initiatives or partnerships that particularly excites you? So kind of loaded, but I'm sure you can address these.
Yeah, thanks. So I do think that philanthropy acts somewhat differently from traditional, that's not a good word, right? The larger donors, the bilateral government donors. But on the other hand, I see in this field in family planning that some of the bilateral government donors have themselves been in an area where you would actually hope to see more philanthropy and venture capital and other kinds of investments. So I just want to give innovation comes to mind as a really good use of philanthropy. Carol mentioned this. But USAID itself actually funded about 3/4 of new contraceptive methods through its partner organizations. And I think that is actually very unique. I don't think there's another part of global health that looks like family planning, but it's an area where you'd hope to see a bit more philanthropy than we have seen in the past. I see philanthropy doing a lot on visibility of big issues, on evaluation. I see them doing a bit more evaluation than some of the standard bilateral funders. And of course, you are our moderator, but the Urban Reproductive Health Initiative is a really interesting program because it was one of the few global health programs at scale that was rigorously evaluated. So you knew something about whether the strategy you were using to support service delivery was actually making a difference or whether it was just the trend going on. So I think that's the kind of thing that philanthropy does very well. I think, when I think about transition ahead, governments are becoming wealthier in low and middle income countries. They are developing their own universal health coverage schemes. And in many times, family planning is left out of the thinking about the benefits that will be assured with public subsidy under universal health coverage schemes. That can sometimes be a difficult conversation for government to have. But it's a really good conversation for philanthropy to have. And this is not something that's specific to low and middle income countries. In the US itself, the issue of whether contraception is included in Medicaid is a big issue. So I think that kind of visibility to a problem as a way to influence policy and think about policy strategically is something that can very well be done by philanthropy. You also asked about some high income countries. Another great USAID story, and of course you mentioned that I started my career at USAID, but while I was there, I witnessed another Hopkins person, Scott Radloff, doing a really interesting way to support an IPPF affiliate in a country that was graduating from USAID assistance. And they set up basically an endowment at the IPPF affiliate that was based in Colombia. And that endowment allowed them to continue to sell services to those with the ability to pay, and it also allowed them to contract with government health insurance to be able to provide contraceptive and reproductive health services over time. That's the kind of thing, I think it's actually surprising to hear perhaps for some that the US government did that, but that's a really responsible way of moving forward, especially if you're supporting a portfolio of non-governmental organizations to do service delivery. That seems like another good place for partnership. And then just because we're sitting on a panel of philanthropists, I do have to say, one thing that you do see in philanthropy is everyone with their small initiative, which is really good and important and interesting and innovative. But for us to learn from it and to translate to the scale, I really do think there needs to be more rigorous evaluation. and more of a view of, how do we get from here to there? If you're successful in implant delivery door to door, what comes next? What do you want government to do? What do you want the Gates Foundation to do? So hopefully we can all sort of learn from each other and try and influence each other till we get to the goal. Thanks.
Thank you, Amanda. So I'm mindful of time, and we're going to be getting to the questions soon. I'd just like to give you all an opportunity to just give me kind of like your last kind of rounding message. But however, I had one question that I couldn't ask you all, and so if you want to weave it in, I'll take it, but then still straight to the point, is I believe that the audience here would like to hear from you as to what you treasure in the partnerships that you form with implementing organizations. What are your preferences for partnership? And so in the midst, can you weave that into your final statement? And can I give you all about half a minute to do that? And so can we start from you, Amanda, and we come all the way towards Carol?
I'm sadly not a philanthropist, but what do I value in my partnerships with philanthropists? I think it's the space to innovate, it's the space to have an opinion and a voice and to try and influence in different ways. And I think the space to do that exists with a lot of the philanthropic partners with which that fund my organization, and I really appreciate that.
Great. And
for me, the exciting thing has to do with the risk-taking and the ability to be willing to fail and to learn from that failure. That's what we're trying to do with Maverick. The other thing I'll just mention quickly is that I think the trend for female philanthropy is also a huge trend. And what's really interesting about female philanthropists is that they approach it differently, and they really want to be more engaged. They tend to be more collaborative. They don't want to just write a check. So I think that's a really important, somewhat untapped group of philanthropists who are willing to form partnerships and eager to form partnerships, but those partnerships might look a little different.
great, thanks, Natalie.
I would have to say, can you hear me? I'd have to say that fitting the puzzle pieces together of a partnership is really what's exciting to me. So finding the strengths of that each partner brings, whether it's the ability to take technical and financial risk from the Gates Foundation paired with the, the funding strength of a DFID or a UK and the creativity of the NGOs delivering it, and putting all of those pieces together to form a really strong partnership it's been one of my favorite things about working on these partnerships.
David, so most of your partnerships may be more with other foundations, but in an event, do you have other partnerships of folks that do implement? What do you look out for in those partnerships?
What do we look out for? Well, what would I look out for? And I guess what should we be looking out for? And I could, in a way, put it in one sentence. I think that the strong partnerships keep us on our toes.
Right.
We have strong collaboration with the UNFPA. We have USAID, and for us it is important. Not that I worry, but I think it's always important to have checks and balances. That the programs that you institute that you keep the focus on the programs that you institute, and that is really, in a way, what one element that we're looking out for. The other element is data.
Great, thank you. And Carol, you have the last word on that.
Then I get to answer it in two parts. So one is, I'll take on the implementing partners. I think our partnership with grantees, that's some of what we really appreciate, and it takes us doing the right thing too, is an honest dialogue where we can get feedback from the grantees about ways we can improve, and also we can offer feedback to the grantee. How do you get that partnership, even recognizing that you just start out with an unequal balance of power? One of the most exciting things I think that's happening in philanthropy, and I've heard about it here too, is much more emphasis on getting beneficiary feedback or grantee feedback, because it can be threatening sometimes to be told what you're doing wrong. But for us at the foundation, we really benefit from that and are trying to build that more into our systems. So we really appreciate that honest dialogue in our implementing partners. But then I'm going to end on the exciting note. What do I really love? So I have been in this position for 15 years, and this is my third of these conferences. And you know, there really is progress. We were talking at breakfast about someone was being described as, you know, the eternal optimist, or almost to the point of a flaw of being an optimist. But it's real. I was talking to Doing at lunch, and you know, there's both the metrics that many of you have cited, but there's also a spirit and a real tangible nature of that. This community is coming together. There is progress being made. I would guess the next conference in a couple years will be even more attendances, and we'll have more examples of countries and communities across the world that have really made breakthroughs on these issues, thanks in large part to Philanthropy and my colleagues on the panel. Thank you.
Thank you all. A round of applause for our panelists. So we still do have some time to take questions, and so I'll take the first three questions. If you just raise your hand, and then we have mics on the microphones on the flank. So do I see any hands up? Okay, so one first question. Any other hand up? Okay, so we'll start with the first question. I see a second one here. And so please be straight to the point with your question, and speak slowly so that the translators can do their job. Thank you.
Thank you very much. My question, anyone can answer that. I would like to know actually how the philanthropists are working with national government, and your program are aligned with national strategic program on health. And the third piece of the question is, some were answered during the partnership part, that how philanthropy scope collaboration or partnership actually reach out to the national level where the need has been generating. Thank you very much.
Okay, thank you. If I'm not seeing, I think we will take a response first before we go to the second question. Does anyone want to take it? Amanda, I can see that you're itching to say something.
Okay. Well, sometimes philanthropists don't work with national governments. I think that's something that one does witness. But I have seen some really interesting initiatives. One that I personally worked on, and that Natalie actually worked on, was in the Central American region, where the Gates Foundation basically crowded in national and subnational governments, and Carlos Slim, then the second wealthiest man in the world, now, is he the wealthiest? Maybe. Anyhow, so it brought together philanthropy with governments to say together, we have a plan to improve maternal and child health in the poorest municipalities in Central America, and we'll work with government to reward those municipalities that made quicker progress on the measures that we all care about. Philanthropy helped with the measurement. They helped with some of the technical assistance. It was the governments that implemented everything. It created this kind of virtuous competition amongst the different municipalities and countries that were participating. Regional entities began to get into the game. It gave it huge visibility at a very small level of investment from the outside. But it was sort of, the philanthropists themselves and their engagement and interest actually galvanized political leadership at a different level than you normally see from a maternal and child health program. So that was my personal favorite, having been involved in it directly, but I'm sure others have great examples as well.
Yeah, so Carol.
Yeah, and I'll just build on that. I think there are a lot of great examples of philanthropy working with national governments, and the thing that I would add to it is it's usually not a 2-year project. In our case, we started working in Ethiopia. Packard started to provide funding in Ethiopia in 1998 or 1999. And so there's been just a lot of progress in Ethiopia on these issues, and through different administrations and different ministers of health and different leaders. And I think by staying for the long term, you can really build those relationships in that partnership kind of way, taking ideas from the government and actually helping on some of the aspects that you were mentioning, whether it's evaluation or piloting something. And I was just delighted that the new Minister of Health from Ethiopia was here today. I saw her and look forward to continuing that. But I do think it's important for philanthropy to have staying power.
Great, thanks. And David, if you would
I'd like to add something. The one thing I think we have to remember is that when we engage with government, there are obviously officials that are elected. There are senior members of government that change with the new regime. And so you will have to find a way to institutionalize your engagement with the government. For us, we decided very early on that we had to work with government because health policy is important. I agree with the previous statement made by Carol that this is not something that happens overnight. It takes a long time to get the buy-in. Usually you find that the departments or ministries are not necessarily always incentivized to be effective. So if you as a government official or as a functionary, you may not really want to stick out your head. So you have to find ways to come in. And for us, it was through training. So we identified people within the ministry who were responsible for regional duties, which at that time were very ill-defined. And I heard stories where we had DOH officials who were actually ended up being drivers for governors instead of doing their jobs, simply because there was no job description as such. So you have to get them to understand what the issues are in the communities. You have to also get them to be accepted by the communities. All these issues take time, but it's really I think if you have patience, if you focus on what you're doing, and again in our case it was a training aspect, it's something that will bear fruit.
Okay, great, thanks, David. And Anne, yes.
Just briefly, our experience in Kenya with working with the Ministry of Health has been fantastic. The PS Kenya staff has ongoing relationships, with the ministry officials, and including them early on in sort of our planning for the project, and kind of building in the partnership from the very beginning, I think is really essential. And if the goal is to collect evidence and to shift policy, I think that they absolutely are critical players.
Great, thanks. I'll take the second question. I think I saw a hand here, Lisa. Okay, so we just take one here and then two there. Okay, if you're close, why don't we just close by do that one? Okay.
Yeah, thank you for the insights that you've shared with us as philanthropists. I was just curious in terms of, from your work that you've done, have you had any challenges? Have you failed in some aspects of your work? I mean, and could you share some of the lessons that you have learned, either in the failure that you have had in your aspects as philanthropists?
Okay, I'll take two volunteers. So first Natalie and then David. Oh, you didn't hear the question. Have there been any instances in your philanthropy where you have failed or some lessons learned that were probably not predicted? I think that's more what the question is. Paul, did I do a good job with that? Okay. All right. So let's start with Natalie and then I think Amanda, and if David, we want to do it. So if we can just do it a bit snappy so we can get to some more questions. Natalie.
Yeah, sure. So the Implants Access Program wasn't all a success. I think from the beginning, one of the challenges we had was how to engage and solicit information early on while we were under NDAs in discussions with suppliers. And that contrast of wanting to be more open but not really being able to, created a lot of, I would say, probably distrust at the beginning of an instrument like a volume guarantee being put into a family planning space. And we had to work very hard to overcome that initial distrust. And so I think setting up mechanisms earlier on to engage countries and implementing partners, even within the constraints of an NDA, is starting the trust early on is incredibly important. I have lots of failure stories, but I'll stop there and let.
All right. So Amanda, thank you, Natalie. From your perspective, have you seen something from your research in that?
Yeah, so we have a book that we do about every 4 or 5 years that's called Millions Saved, where we look for programs that have had an impact on health at scale. And this past, 2 years ago, we did a version that included, I don't like to use the word failure, but I do like to use the word disappointment. And what was so interesting about those cases of disappointment is that in every case, it was a proven cost-effective technology. So we know that contraceptives work. In every case, it was done well. It was a good faith implementation effort. But what you usually found in some of those cases, I guess my thought was that you could learn so much from looking at those cases where you didn't get the impact that you hoped, even though a lot of the ingredients were right. So things like, did we actually diagnose what the problem was well? Were we understanding what the barrier to access was? What was our service delivery strategy? Did it make sense? Could people afford it? So I think that learning from that, I really liked your question because it's not often asked.
Great, thanks. I will take the last question. As I can see, Jen is telling me I have 5 minutes. Lisa, did you lose your mic? Oh, okay. So there's a question there. Okay, please go on.
Thank you. My name is Peter from Kenya. I can see a panel of experts, those who have, I can say you have a huge chunk of experience, and we have implementers here. My question is, maybe even the implementers may answer it, but I'm directing it to you. With that experience, as we grow, there are also opportunities coming in the countries that we come from. So I'm asking whether you have that engagement where you are encouraging new philanthropists to come on board. Like from those countries that we come from, we may be having those people who are willing to come, even if it's in a small way. Maybe what can you say about that?
Okay, thank you. I just need maybe two volunteers very quickly to probably respond. Okay, Anne.
If I understood your question correctly, you're talking about philanthropists from your own countries, is that correct?
Exactly.
So in Maverick Collective, very exciting development in that particular area. Our new co-chair, Dr. Precious Masepe, is from South Africa, and one of her main focuses is going to be on identifying and growing women philanthropists in Africa, for Africa. So I think that is a huge opportunity, and really what we all should be talking about now is that there are, the way so many countries' economies are expanding, there are those opportunities for homegrown philanthropists.
And really, it's also about, like Carol, as you mentioned, creating the vehicles for these philanthropists to come in. You don't have to be have several zeros to your name to be able to get into philanthropy. David, were you going to say something on that before I just round up? Well, because I see you nodding your head.
I certainly agree with your last statement. I think I was a bit intimidated when I heard about the amount of funds that in the U.S. that go into philanthropy. In Asia, we're nowhere near that base, but I think that how can you attract more philanthropists? In a way, the problem arguably takes care of itself, because you have more wealth, and what I also see is you have people, particularly younger generation, which is more susceptible to doing things differently.
Mm-hmm. Great. Well, thank you. I mean, we're out of time, and you guys have been a fantastic audience. But again, and thanks to you. But thanks to our panelists. Carol Larson of Packard Foundation, David Zuelik of the Zuelik Foundation, Natalie Revell from the Gates Foundation, Anne Morris from the Maverick Collection, and Amanda from the Center for Global Development. Thank you all very much. It's been exciting, and I think we've gotten some insights as to what is going on in the minds of the philanthropists and in this changing environment of donor funding. So a big thank you for it, and I think the conversation doesn't stop here. And we, from the Challenge Initiative, as we're benefiting from this new wave of funding, we will continue to create platforms for more conversations around this topic. So thank you once again, and a special thanks to Jen Guertin, the Director for Donor Engagement of the Challenge Initiative, for putting together such a fantastic panel and coordinating all this. Thank you, Jen. And so once again, thank you to our panelists. A round of applause for them, and thank you very much.